100,000 prisoners have been temporarily released from jails over in Iran, and a ceasefire has gone into effect in Yemen. These are just some of the examples taken by countries in the Middle East to contain the spread of COVID-19. For more, we can speak to Ruth Hetherington, Middle East spokesperson at the International Committee of the Red Cross. Thank you very much for joining us here on France 24. What does the Red Cross need to help contain the spread of COVID-19 on the ground in the Middle East, given that many developed countries themselves don't have the necessary protective gear nor testing kits?
Exactly. As you say, COVID-19 is one more deadly threat to people's lives and well-being in the Middle East, an area with conflict zones where people are already struggling to get by and struggling to have the basics that they need to survive. In 3 countries alone, Yemen, Iraq and Syria, there are 40 million people who need humanitarian aid already. So 40 million people who every day need food, aid, shelter, and that's before we even talk about healthcare. So what we need is access. First of all, access is always critical. It's more complicated now with movement restrictions, with border shutdowns, but we're working around it, and we are on the ground and working very hard to make sure that we can implement and boost prevention measures to make sure the virus doesn't get a foothold in conflict zones and among vulnerable populations there, but also so that we can continue our life-saving services that we do every day, such as water and electricity provision.
So what are you advising the populations, in these countries, Yemen, Syria, Iraq, etc.? What are you advising them to do? Because from what we've realized is social distancing in many parts of the world remains a luxury.
Yes, well, information is key, clear, practical, simple information on what's going on and what people can do to protect themselves. As you mentioned, one size fits all just doesn't apply. It is difficult to physical distance in an overcrowded prison, for example, impossible. Displaced people living in informal settlements, for example, don't have running water, mightn't have power, very difficult for them to adhere to the same sort of prevention measures that are being advocated elsewhere. But there are things we can do. Prevention measures can be effective, have been effective. We've worked through outbreaks before. We've seen that there are things that can be done to avert the worst. So besides distributing information, we're also giving people, displaced people, detainees, hygiene kits, including soap and shampoo. We're working very hard with authorities to make sure that they include these people in any contingency plans and that they have the equipment they need. We're donating tens of thousands of units of protective clothing, equipment, disinfectant, cleaning materials to prisons, places of detention, to camps where we can. And then, of course, we are boosting our existing support to people and healthcare facilities and authorities. And, of course, the national societies, our Red Cross, Red Crescent partners, who have tens of thousands of volunteers on the ground working in communities every day.
Now, this is a health crisis, what the world is seeing, but for many countries around the world, the economic consequences of lockdown measures, in place are just as dire. Do you share that assessment?
Exactly. It's a health crisis, but it's not just a health crisis. And we are seeing globally this is having a socio-economic impact. The Middle East is no different. Again, it's the most vulnerable people who are on the front line, low-income workers, people in the informal economy, households that are headed by women who are single parents, the breadwinners, and having to do that in a conflict zone. So we're seeing already at a household level that it has had a socio-economic impact. The measures such as lockdown and curfews are affecting people's abilities to go out and work. People are having to make impossible choices. Do they stay in to stay safe, or do they go out to feed their family? So choices that nobody should have to make. Millions of people in conflict zones have to make them every day, and this new crisis has exacerbated that. So we are upping our support. It's very important that we do prepare to support people through the long-term consequences of this. So continuing our economic security programs, for example, making sure that people that we are supporting with small businesses and rebuilding their livelihoods, that we are now activating temporary cash transfers to ease them through this period and thinking beyond as well.
Ruth Hetherington, we're going to have to leave it there. Thank you very much for joining us on the program today.